Once again, thank you everybody for attending our webinar today. This is part 4 of our coronavirus education series. And today we're going to be talking about being proactive and transparent during this COVID virus outbreak, and really want to talk about the next paradigm shift towards overcoming the coronavirus crises in the skilled nursing facilities. As we all know, we are going through a crisis within the healthcare system as a whole, but that crisis is slowly shifting away from the hospital and quickly shifting to the skilled nursing facilities, which we've been anticipating. First of all, I want to make sure everyone can hear me. If anyone just types a yes, I would appreciate it. So as we move forward into your question box. Okay, perfect. I got a lot of yeses, so you guys can hear me just fine. So let's keep going. First of all, thank all of you for attending the webinar. We greatly appreciate it. I'm always very excited to see such a large number of attendees from all over the United States attending our webinars. So thank you from every state that you're in from attending this webinar today. And then once again, thank you to each and every one of you nurses and every administrator, every frontline worker in every way possible, just for managing patients, still showing up at work and being committed to the work that you're all doing. Without you, none of the great and wonderful care that's being given out there would be made possible. We know that each and every person is putting their own personal health at risk just to manage the health of others. And, that's what healthcare is all about. And we just want to say thank you for that. And we really appreciate each and every one of you. All right, let us begin by defining a few terminologies that I think are going to be play a role throughout the rest of our discussion. The first word is transparency. Hopefully you guys can see me and hear me. All right, sorry, I just got a notification that I might have had a drag in communication. Okay, hopefully you guys can still hear me. If anyone can't, please type in. So the first word we want to define is transparency. And transparency is defined as the availability of full information required in this is proactive. And proactive, by definition, is the act of anticipation of future problems, needs, and changes. And when you think of a proactive, greater emphasis towards forward thinking strategy as opposed to reactive strategy. Think back over the last weeks with our webinar, we've really been ringing every sort of saying and predicting our now. We've been learning about the surge that's coming to the skilled throughout the United States, high population of COVID diverse. We've been federations updating those and now sending out a task force to infection control protocols with the SNF. We've been each and every facility prepared for the inevitable and all the different recommendations to prepare yourself. Just even mentally embracing the moment. We alarm about that. Well, because we knew this was coming, and we within the nursing home to the York have already 95% of their residents and staff are positive. And so this is what's happening all year. And unfortunately, we're going to continue to expect more of it as testing continues to be available for nursing facilities. So as the high number of positive cases occur between residents and staffs, example 40% unfortunately of the deaths treated and out about it. Even the state like Massachusetts, 77 nursing home has COVID-positive residents with all dying in their families. So it's a big deal, and this is on the federal government to focus on now so specific nurses. The Trump administration talking about it every meeting that they you'll hear CMS, of course, reporting on regulation recommendations on all of the regulation rules. Forget all of the federal of all regulatory bodies in skilled nursing facilities. Once again, we have to continue to prepare ourselves and embrace it. And as early as last week on October 9th, CMS released new guidelines to the state, giving a specific confirmation and direction with regards to the federal government, because these guidelines were only required. I'll go over what difference of states, federal government is, because they've realized, as we talked about in the previous webinars, the data is hospital-based. Most of the data was coming from. There's always this lag behind where the skilled nursing facilities was always underreported and never actually, or potentially not even included appropriately in the data being reported to government. And so what CMS recently did with the Trump administration really reinforced the existing requirement of the state to report timely manner any cases of healthcare associated infection or through all of the state. So current policy speaks to making sure that with regards to COVID-19, any patient who has been deemed suspected, so that would be considered a person under investigation for COVID-19, needs to be reported to state. Any patient who is positive, of course, needs to be reported. And then any resident who with severe respiratory infection that might have resulted in a hospitalization or even a death needs to be reported to the state. Lastly, if you have 3 or more residents with new onset of respiratory symptoms over a 3-day period, that also needs to be reported to the state. And so the main and most important thing is now the time period. That has to be reported within 12 hours of the discovery of that one of those 4 conditions. If it's not, then the facility will be penalized for it, and that's really the big deal. And then the other is, it's no longer just reporting to the state, but we have to now report to CDC directly. And so there will be a portal that will be set up for reporting directly to CDC. So it's not just reporting to the state, but to CDC as well. And that has to be done in a very timely manner as well. And that's really the big pipeline, because the federal government needs the data right away, and they're not relying on the states anymore to provide that data. Do they want a drag time in receiving the data? That's this 12-hour period. And if you do not apply with the 12-hour time period, you will be fined. There's a picture of Seema Verma, who is the CDC administrator, and she recently spoke on this, noting that nursing homes will face a fine of at least $1,000 per week per patient for not reporting COVID-19 infections within a 12-hour time period of learning about the infection, as well as any of the other conditions that we noted earlier. So it is very, very important that every facility complies to this, becomes proactive and be transparent about what's going on in their facilities. Along with reporting the new regs that recently were released that will start being enforced as early as next week, we'll talk about the importance of the facilities, including the information when they do report what their mitigation actions were that were implemented to help prevent or reduce the risk of any transmissions, and then if they make any changes to any of their current operations after that COVID case or high-risk symptoms were discovered. And so basically, you're literally reporting with a plan of correction at this point when you start reporting these numbers to the state and to the CDC. So that's part of the new requirement. So there is a huge component of transparency that the federal government is really implicitly wanting to make sure that we all implement. And that's that not only are we notifying the state and then notifying the federal government, but now notifying every resident in your facility as well as their family members and also your staff included, because sometimes staff happens to not be there the day of a positive patient, to keep them up to date on any conditions that occurs within the facility and if there's been any positive cases. So family members and staff and residents all need to be updated in real time. That's really, really important. And one of the things that they're really expecting is that every facility fully cooperates with their new surveillance efforts that they're going to have within the skilled nursing facilities. Before I move on, I'm going to answer a few questions and then we'll talk more about the surveillance. And so it looks like right now we have one question from Angela, and she asks, question, if you test positive, I'm told we can go back to work after 3 days of no fever without taking fever reducing. True or false? So let's talk about returning. So if you test positive, two symptoms, two issues. Let's talk if you test positive or if you've been exposed and you didn't have any PPEs on, and so you're now a person under investigation. If you have to be quarantined for 14 days. If during the 14 days you're asymptomatic, whether you're positive or not, you're asymptomatic for the entire 14 days, you can return to work after 14 days. Now, if at any given time during the 14 days you start to develop symptoms, from the day that you develop symptoms, within the 14 days, you have to add an additional 7 days to make sure that you are now officially symptom-free for a minimum of 3 days at the end of your true complete 14 days from the day that you felt symptoms or the day that you began your quarantine asymptomatic. I hope that makes sense. But so your question, if you can return to work after 3 days of no fever or no medication requiring for fever, is that true? Yes, you can, but you still have to complete a 14 days of quarantine. So it's not just 3 days of being asymptomatic and then you go back. It has to be 3 days within the last 3 days of your 14-day quarantine if you have been positive or if you have been exposed with no PPEs. Okay? All right. So hopefully that helped clarify that. Let's keep going. So today's presentation is not actually as long, so that's hopefully it's nice to make up for the last one where we spent about 2 hours. Let's talk a little bit about surveillance. The federal government is very aggressive about the surveillance tactics and methods that they're implementing for nursing facilities. So test sides to the side is they're going to bring in a lot of testing and a lot of support and a lot of PPEs to the skilled nursing facilities, which is wonderful. But the other flip side to it is that they're going to bring in a really hardcore surveillance team because they want to make sure that every single positive or suspected case is identified. So surveillance for COVID-19 in the skilled nursing facility is going to look a bit different, and about a few. So one thing that they are really impressing upon every facility is that it will be mandated that every federal agent or anyone working for the federal government, whether that's Department of Health, whether that's CMS, whether that's anyone under the veil of the federal government, will have immediate access to any resident or at any time. And so that includes anyone who's a representative of the federal government. And so, and the other is this, their goal is to get all of their agents out there performing on-site infectious disease surveillances. So that means they're going to be testing healthcare workers, they're going to be testing residents, and they're also going to be deep cleaning and providing other support services to the skilled nursing facilities and bringing in equipment. But they're going to be doing it basically their way. So we have to make sure that we are supportive, we embrace it, and that way we'll allow them to do their job, so that way the nursing homes can get the support they need. Remember, nursing homes aren't always painted as light, and so it's really important to use this opportunity to make a shift in the community and really show that we're being proactive about taking on the challenge of having COVID patients in our facilities. So what does full cooperation actually look like? Okay, before I get into that, let me answer a few more questions. Let's see. Oh, you guys were unable to hear me. Can you guys hear me now? Can somebody type in yes, or should I go back? It looks like I should go back. You guys couldn't hear me. Let me go back a few slides. Oops, give away my slides. How about here? Is this where you guys could hear me? Can I get a yes or a no from anyone? Okay, so, okay, yes. Okay, thank you, Leticia. So I'll restart from here. So I want to make sure that everybody could hear me. My apologies, I had no idea I was breaking up. Thank you. Thanks for informing me. And I will actually, you know what I'll do? I'll answer questions, a few questions people had, and then I'll restart this part of the presentation since we took a little break here. Let's see. Okay, I got bad connection, apologize, unable to hear you. There's a lag. 14 days plus 7 days with symptoms. Yes, so someone asked, or Angela asked, is it 14 days? So you must complete, so if you have a positive infection and you have to be quarantined for 14 days, if during the 14 days you're asymptomatic, you can return to work without any follow-up testing. And if during the 14 days you become symptomatic, you have to add 7 days to your 14 days from the day you became symptomatic. And at the end of the last 3 days of your quarantine, whatever that total is, whether it's 14 or 21, you have to have at least the last 3 days must be symptom free for you to be able to return back to general population. So hopefully that helped clarify it. Let's see, it looks like everybody can hear me now. Let's see, can you guys hear me now with no issues? I want to double check before I move on. Can I get a yes or a no? Okay, I got 2 yeses, 3 yeses. Okay, that's good. So did everyone hear my answer regarding the 14-day quarantine if you're positive, and 7 days, you add 7 days to it if you become symptomatic, and then you can't return until you have at least 3 of your 14 days or your 21 days be symptom free. Yes, okay, great. Everybody's saying yes. Awesome, thank you. All right, so now I can continue with a little bit more confidence. So going back to where I think I started losing reception or communication with everyone, I was mentioning that CDC and CMS is now requiring that that every facility reports their COVID positive cases in a timely manner, and that report must be done not only to your local government, which would be the Department of Health Services, but now you have to report directly to the federal government through a CDC portal that's going to be created and released by next week. And so that reporting must be done in a timely manner. So it must be done within 12 hours. If you do not report within 12 hours of the discovery of any of the above components that we went over, which is having a person under investigation, such meaning a suspected case in your facility, having a positive case in your facility, having a symptomatic patient in your facility who ends up getting admitted to the hospital and or dies, or having 3 or more symptomatic patients within a 3 days occurrence in your building, any of those are all considered reportable and must be reported within 12 hours of identification. If you do not, you will face a $1,000 per week per person fine or per case fine for any of those incidences. And one of the things when you do report that's required is that you must report pretty much a plan of correction. What mitigating actions you implemented to help prevent or reduce the risk of that transmission and also further transmission in the future, and then what alterations you may have made to your normal operations after you discovered that transmission. So ultimately, you have to report with a plan of correction at the same time. So it's not just reporting alone, but you have to report saying that this is what you're going to do about it in the future, and this is what you've done now to prevent it from ever happening again. And then there's this new level of transparency that must be provided by all nursing homes. And this is important because what the federal government wants to do is to make sure that everybody is notified. And so anytime you have a reportable case in your facility, you have to now notify all of your residents in your facility, all of the residents' family in your facility, as well as any employees that work for your facility. They all need to be notified. And this is important because as everyone is educated and knowing what's going on, because families have sort of felt left out, or employees have unknowingly been not protecting themselves because they didn't know that they were working with a COVID positive patient. So the federal government wants to make sure that this is no more, that everyone is open, transparent, and proactive about giving information. So then the next level of emphasis that the federal government wants is really a full-blown cooperative effort towards surveillance. And the federal government surveillance plan is very aggressive. And one recommendation we have is to make sure you pretty much stay out of their way. You embrace it. You allow them to come in and do what they need to do because they want to make sure that they get accurate data on every single resident and every single employee and every single person that's inhabiting the skilled nursing facility. So under this new surveillance, there is a mandate that prevents anyone from pretty much saying no. And it says, so it's a mandate that mandates immediate access to any resident by any representative of the Secretary of State or Secretary or by the state. So whether it's DHS or someone from the federal government, CMS or the feds, the nursing homes need to make sure that they're opening their doors and they're allowing them in and they're allowing them to answer and ask any questions that they need to ask. And so what are those federal agents or CDC representatives or surveillance teams going to be doing? Their goal is to go on site and provide infection disease surveillance by testing every single resident and every single employee in every single building in the United States. That's ultimately the goal. But they're also there to provide support services, such as bring in PPEs to the facility, as well as helping the facilities by providing deep cleaning of facilities to help just mitigate any high risk for contamination or infection. So what does full cooperation look like with the surveillance program that the federal government will be releasing? And that's literally having the National Guard in your facilities. And that's where we're at with it. And it's already happening in multiple states. I'll give you some examples. And so you're going to have states already that already have the National Guards present in their facilities, providing deep cleaning and comprehensive testing throughout. And so here's an example in Florida where you already have the National Guard going through every hallway, going through every patient to make sure that every patient gets tested and that they have accurate data on the number of patients that are COVID positive versus those who are not, and those who are symptomatic versus those who are not. So that's happening. California is happening as well. There's a newspaper article in the LA Times that writes, as the death tolls mount at nursing homes in California, they get the help from the National Guard to help manage the scenarios. Oklahoma, we're seeing the same thing. National Guard is showing up to help assist nursing homes with cleaning efforts, with supplies, but also with providing testing and doing the testing themselves for accurate surveillance. Colorado, we're seeing it too. A nursing home chain got 900 people tested, of which fortunately for them only 20 were positive, but all of these were done by the National Guard. So it will be in every state relatively soon. And so Seema Verma, the administrator for CMS, she's in one of her presentations, she spoke to the idea of having a full-on approach to making sure that we have the most accurate data possible. She states that nursing homes have been ground zero for COVID-19. Today's actions support CMS's longstanding commitment to providing transparent and timely information to residents and their families. Nursing homes reporting that nursing home reporting to CDC is a critical component of the go-forward national COVID-19 surveillance system and to effort to reopen America. So basically, they're really going hard at implementing this data to make sure that, or getting the data required to make sure that as we continue to reopen America, which is going to start relatively soon, they know where the majority of the highest cases are. So one of the things that also important is that CMS is also reallocating a lot of the surveyors. As we know, many facilities were still having traditional surveys occur during this time. And so what they're doing now is that they're repurposing the surveyors to focus mostly on infection control protocols and implementation of those protocols and what we're doing, the nursing homes are doing to prevent transmission of the coronavirus. So you want to be prepared because as surveyors go into your building, they're going to be looking for those scenarios. And if they find anything that they feel is poor compliance or non-compliance with all of the new CDC regulations and they'll be handing out IJs, and that's pretty much what it's come down to. And so they're very serious about it, and they want to make sure that it's being highly enforced and that every nursing home is being proactive about doing the things necessary to prevent infection. So I'd like to share a video with you that was given to me by the VP of operations for a large nursing home chain that I have a great friendship with. So he shared this with me because their facility is experiencing this challenge. But this video was awesome because it really speaks to the need to be open, to embrace the moment, to not be afraid, to be transparent, to be proactive, and do everything possible to protect your residents in a positive but in a proactive manner. So let's listen and watch this video, and then after that, we'll continue our presentation.
In Los Angeles who had just been discharged from the hospital began showing coronavirus symptoms. So their nursing home, Briar Oak on Sunset, isolated those two residents and tested them. And when their tests came back positive, Briar Oak decided that they were going to test all the staff in their facility who had been in contact with those two residents, even though none of the staff were showing symptoms. Even for showing symptoms, 15 of those staff tests came back positive. According to Briar Oak's director of clinical operations, quote, with that number of positives, now you have to be concerned about the possible exposure of everybody. Now, the problem, of course, is that Briar Oak couldn't test everybody, despite being the place where the most Americans are dying from coronavirus. Nursing homes have largely been on their own as individual facilities in terms of trying to get a hold of tests for their residents and their staff. So pretty much no one at any facility anywhere could test everybody. But some nursing home leaders in LA were trying. And it turns out there was a larger long-term care facility, the Los Angeles Jewish Home, that had managed to get itself several hundred coronavirus tests from the city. And the LA Jewish Home agreed that they would give this other facility, Briar Oak, enough tests to screen all their residents and all of their staff, which was a really stand-up thing for them to do. And Briar Oak was able to then do all that testing, and what they found, well, curl your hair. 75% of the residents had the virus, 90% of the staff had it as well, which meant that Briar Oak immediately became possibly the worst outbreak in the entire state of California. As of today, 70 staff at Briar Oak have tested positive for the virus. 3 of their residents have died. But the key here is that this one nursing home have this extra terrible, significantly worse outbreak than other facilities, but maybe that's because they're the only one that tested everybody, right? And the only reason they were able to test anybody is because of this sort of accidental circumstance in which they got this incredibly neighborly help from a nearby facility. I mean, maybe if every nursing home had universal testing, we would discover that lots and lots of places are as bad as Briar Oak, and we could get them resources to try to deal with their problems. You know, we'd at least be able to see the scale of the problem that clearly needs to be tackled in these facilities where the most Americans are the most at risk of death.
So thank you guys for listening in on that video. So I think the video kind of really speaks to what the challenge is for the skilled nursing facility, having enough resources, but also just be willing to sort of deal with the challenge head on, and that way we can get the kind of resources and help required to be able to solve and manage and mitigate the problem. So with all of that, the key is to really get away from being reactive, not waiting for the National Guard or state surveyors to show up, and now suddenly you go from having 1 positive case to 100 positive cases in your building, including your residents and your staff. But it's about now just becoming more proactive and really taking this whole scenario and this challenge head on. When you're in a reactive state, it's extremely stressful. You're kind of always chasing your tail. You can't really get ahead of it because there's no real strategy or plan in place. Versus when you shift from that that reactive state into a proactive state, you're able to truly prevent problems. You can think clearly, you have a strategy, your team and everyone on board knows exactly what their responsibilities are and what they need to do first, second, and third. When you run into a problem, you know exactly what may have occurred and how to resolve it relatively quickly. And so that's a huge, huge paradigm shift that we're hoping everyone in the nursing home business or world kind of embraces. Because if we're all proactive and have a proactive plan, as these numbers can rise, it won't be from a sense of fear, be from a position of strategy. And so I'd like to end our presentation today with just talking about proactive action plans that we all need to make sure we're trying to implement. Number one, be transparent and start self-reporting as soon as possible. The faster you get ahead of it, the better. And that's making sure that you're reporting on any resident or staff who may be suspected. And that includes, that will obviously be any person under investigation, right? And that's what they're classified as. Or any person or staff, any resident or staff who is COVID positive, or any resident who may be exemplifying severe respiratory symptoms or be infected, have a respiratory infection and get admitted to the hospital, or may even die. Those need to be reported. And of course, like we mentioned, having 3 or more staff or resident with a new onset of symptoms within a 72-hour period. So 3 for 3, 3 patients or 3 residents, or a combination of either or within a 3-day period of new onset of symptoms. That also is reportable, okay? And then, of course, being transparent, keeping everybody informed. That includes the patients, all the residents in your facility, all the family members of those residents in your facility, and then, of course, all of your employees, making sure that everybody is aware of any new incidences that's reportable that may be occurring. And then next, educate and re-educate again yourself and your staff of all of the new infection control guidelines. That's really important. Our last 2 webinars, we went into detail of what those are. So always go back. If you're not sure, you can go back and watch those webinars. We really do go over those. And as you're implementing those, it makes a huge deal in making sure that you're proactive in trying to prevent the spread of the infection within your facility. And then, of course, implement those guidelines. So it's one thing to educate about them and learn. The next thing you have to do is implement. And implementation is always harder than education. So that's really where a lot of the grind and hard work takes. That's where the rubber meets the road, as they say. And then also make sure you have a QAPI system for your interventions and your plans that you're putting in place in your guidelines. So that way, as you copy those interventions, if any of them need to be improved, you can improve upon them, because there's always going to be holes in our armor or gaps in our spaces that we can always seal up, but you have to reassess, whatever you put in place to make sure that it's working, and that's really critical. And then lastly, or as we near the end of it, make sure you ask for help. You're not in this whole scenario alone. Ask for help from either your collaborating, your partners. Ask for help from the government. Ask for help from the state. All of them and all of us, just here, even at Skilled Wound Care, we are here to help you. And so, in every way possible, we do these webinars. And not just because we want to provide free continuing education units, but really because we want to provide content that'll be helpful. But we can provide this on an individual level. We can be helpful in every way possible to making sure that all the facilities that we work with throughout the United States are successful. And if you don't work with us, reach out to us. We will still be helpful nonetheless. That's really important. And then really important, comply with all of the CMS and CDC interventions and surveillance actions that's going to occur in your facility. When they come in, it's always intimidating when suddenly you have a lot of people in your building and everyone has masks and all of these things going on. And so we just tell you, let them in, invite them in, embrace them. It will be helpful. It will change everything that's going on in your facility. And so you want to make sure that as CDC, CMS, DHS, and of course the National Guards show up, you want to be transparent, be proactive, open your door, invite them in, and ask for their help and let them know what your challenges are, so that way you can get the right support. And then don't forget, we're available. We're still rounding within the facilities, using proper PPEs. We can educate on how to use them appropriately. We can review guidelines with you on a one-on-one basis with your facility. We can individualize all of that. So we are partners for you. And like I said, even if we're not working with your facility and you're on this presentation, reach out to us. We will make sure that we will show up and be there for you there as well. and that's throughout the United States. And let's close out by just reviewing some of the predictions we started with and see where we're at with them. We've said early on that most of the nursing homes in the US will have at least one COVID positive patient, and we're kind of unfortunately heading in that direction. Most of us will get exposed from the virus, and most of us will be asymptomatic. But unfortunately, potentially over 100,000 people may die. Currently, I believe I didn't put up data today, but the last number as of yesterday was 53,000 deaths and 987,000 plus positive cases. So we're getting near the 100,000. The million number for positive cases, and we're already over 50,000 for deaths. But the skilled nursing facility is going to be a huge emphasis now, and we can affect these numbers if we continue to implement and improve our infection control measures and protocols. Like I said, there's over 1.3 million Americans living in the nursing home, and so that's a lot of patients that potentially could die, because the nursing home population is always going to be your highest risk patients in a high risk environment. And the National Guard will be in most of the US facilities trying to do their part to provide support. So definitely embrace them. We're going to be seeing them everywhere soon. If they're not in your facility yet, they'll be there sometime soon. So keep that in mind. So it is important as we end off, we're going to end off the way we always end our presentation, reminding everyone to keep working together as a team. That's really important. I always think this is a great image of showing how everyone is helping others to be successful, because we're all in it together. Make sure that you are implementing your hand washing techniques as much as possible. Wash as much as you can. And then make sure that you are masking yourself and you are masking your COVID positive and suspected residents. Really important as part of the infection control protocol. You wear your mask and you are masking all of your symptomatic and your positive residents. That's really, really, really important in helping to prevent the spread of the infection. Don't forget to implement using units where we're separating your nursing home into different units and assigning units to specific employees only, so that way we reduce the spread of the infection. Please watch the previous webinars to review that concept. And then, of course, use hand sanitizers when hand washing is not available. Really, really important to make sure to do that. And so that's critical to preventing the infection as well. And then stay positive. Stay positive, not just for yourself, but for your coworkers and your residents. We talked last time about what happens to residents during this time. And so the positive energy that you bring can be infectious, and you can spread it to everyone else around you, and they'll be positive and happy too. So continue to do that. Be a leader in your facility and guide everyone in the right direction. Use information and education that you're gaining to be able to share with others, because we think that's critically important. And we'll conclude today by asking any questions. So let's see, I have a few. Angela noted we have 58 patient residents and several nurses. Facility won't tell us how many staff that are positive. Yeah, it is a bit frustrating, and that's why we're really trying to push the agenda of being transparent and being proactive. If you're not now, unfortunately, every nursing home will be by force. So the federal government has pretty much assumed that most nursing homes are not telling the truth, are not giving the most accurate data. So they're coming in with their own people, which is why they've enlisted the National Guard to come in and basically start testing residents on their own, with or without your okay. And that's why they have a mandate that's saying that everyone must comply or face penalties. So unfortunately, if you don't know the number of residents or number of potential positive employees in your building now, within the next week to 2 weeks, everybody will kind of have a really clear idea, because the federal government needs that data. And so they're going to go out and get it themselves. once you have, next question, once you have tested positive for COVID-19, will you be considered immune, or can you get it reinfected? Generally, with most viruses, once you've been infected, you generally cannot get reinfected again. So I've read some saying that potentially you can be reinfected, but that's kind of inconsistent with the normal way of immunity is gathered. Now, if your body does not produce a sufficient IgG, IgM reaction to it, where you produce sufficient antibodies for it, maybe because you're already immunocompromised, then yes, there is a high risk of reinfection if you have a high viral load of that same contaminant. And that's with any infection. So, but generally, if you get infected and your body goes through the normal pathophysiological processes of developing standard immunity, and now you have antibodies for it, the next time you're exposed to that contaminant, you will not get infected. Your body will know how to fight it off. So that's the general rule. So even though I have read, I've read that idea of reinfection and I've seen it, none of it has been validated, at all, at least not that I've come across. So, and it's not, like I said, it's inconsistent with the standards of the science. And the only time that, like I said, can occur is if a person is already immunocompromised and they're not able to mount a sufficient antibodies for that for that virus the first time. So for that reason, when they're re-exposed with a higher viral load of it, they can get infected. Now, if this virus in the future mutates, then yes, you can be reinfected because it'll be a new version of the virus, and which is common with the flu. Every year, it's always evolving and mutating. And so for that reason, people could have had the flu last year, but get the flu again next year, but it's because it's a different strain of the flu. So, all right, a couple more questions. Nicotine. So article says nicotine, not tobacco, Pepsid, UVC light to kill the virus. Have you read any clinical articles on this? So UVC light will kill the virus. I haven't read about nicotine versus tobacco not killing it, and Pepsid. Pepsid, I haven't really read about. I do know that the virus, period, does not do well in the gut. So meaning if you eat vegetables or food that's latent with the virus, and you swallow it, ingest it, and as long as it doesn't end up in your airway, like you aspirate the food on the way down, when it gets into your gut, the normal gut flora will kill off the virus and move on. So you don't get infected by eating it as a food per se. So the Pepsid analogy, I haven't come across. I just know that the normal gut flora will kill it off. But on the surfaces of items, UVC light will kill the virus on surfaces. So not UVA and not UVB. So be careful. I know that you can go online on Amazon and buy different UV light spectrums. Make sure that if you're going to buy, you buy the one that's UVC, or at least it has all three. But UVC is what's going to kill the virus, not UVA, not UVB. So keep that in mind. Okay. So great question there, Gabriella. And next question from Angela: where can we go to get tested for antibodies? Yeah, so probably the next webinar we'll talk about things like that. So antibody testing is the next big thing. But unfortunately, it's very hard to get right now. Right now, nasal testing is the most common thing available, which is testing for the acute infection. But antibody testing is wonderful because you'll be able to know if you've already had it, if you've been exposed, and now you've overcome it and you've moved on. So you can go to your local hospital, but hospitals aren't actually just providing it as a random test. You can try going through your primary care doctor, who can help hopefully with whoever they're contracted with. They can help work with the lab that they're contracted with to hopefully get the test to you. So antibody testing is available. It is the best way to know that if you've been exposed and now your body has developed appropriate antibodies for it. But it's not readily available yet but I would say probably in the next 4 weeks, it'll be everywhere and it'll be easy for people to get. It will be, I've even read some places where, not where it's going to be a requirement for people to have, but it's going to be where most people will be encouraged to know to get antibody tested to see if they've been exposed or not. And next one from Michelle. There was a paper done on patients who had no real signs or symptoms of COVID, but experienced massive strokes. Do you have any insight to the effects of COVID-19 and hypercoagulopathies? So yes, actually actually it was over the weekend, I read an article regarding that, and also have a friend who's a radiologist, and he's been seeing what's happening is that, according to, because I had a discussion with him about this, they're seeing it's not happening throughout the body where they're having these hypocoagulopathic states. It's happening in the lungs. And so as the patients develop COVID, sometimes, as we know, it's a respiratory infection. He's saying that what they're seeing is they're seeing spots in the lungs where either patients are developing small little pulmonary embolisms that could float up to the heart, to pass the heart into the brain and then cause the stroke. So they've been seeing an association with that. So, but no one, I haven't come across any specific articles saying as to why or where it's affecting in the coagulopathic pathway that the virus is affecting. I'll read on it and hopefully I'll get more information. So the next time we have a webinar, I'll be able to provide a little bit more clinical in-depth information. Thanks, Michelle. That was a great question. And Angela asked, I was told that if one family member is infected, it is considered that the rest of the family is also infected. Should they be infected or only quarantined for 14 days, go back to work if asymptomatic? So great question. So if one family member is infected and they come into the home with no PPEs, and obviously families are very close knit, you should consider everyone in the household as exposed. So if you have a family member who is infected and everyone was unaware of that infection, then everyone who has shared space with that person is considered exposed. So everyone in the house should be quarantined for 14 days. And then providing everyone is asymptomatic, at the end of the 14 days, everyone can go back to work or go back to normal general population. So great question. Recently, there were talks about remdesivir as an accelerant of recovery. I haven't done too much research on this yet, but have you read any clinical studies on this? So this is from Alexandria. So I've read mixed studies on it, on remdesivir as an aid to recovery from the virus. And they've had mixed results where they've had cases where patients that were treated with it, some did really well and others did not. And they can't seem to figure out why some are doing well with it and some aren't. I'll continue to read on it. So hopefully I'll find some more information as to why some patients aren't. The challenge with all of the information is that every study that's printed is so new. And there isn't a large, massive pool of patients to do a true double-blind study for. So where anyone can have really consistent data that you can explain or that you can back specifically. So that's why there's so random information out there. And so sometimes it appears to be inconsistent, but it's just because the population pool that they're assessing is so small. Next question. So are they having PEs? Yes, some are having PEs. Gabrielle is asking regarding the patients that have hypercoagulopathy with the virus. There has been some cases of patients having PEs. A lot of them, of course, died of pneumonia, but now they're looking back and seeing that a lot of these patients may have also had PEs along the way. And so that has been a consistent retrospective review of the of some of the characteristics. And a lot of these are incidental findings. The radiologist that I spoke to, a friend of mine that I have, he says a lot of times the doctors, like in ER, are ordering abdominal studies, and so you just have the lower lobes of the lungs showing, and they're not even doing, because patients are coming in with abdominal pain, but then they see in their lungs, they can see already small early signs of emboluses forming. So, and last question, if one family is infected, should all of the rest of the family get tested with or without symptoms? So currently, they're still trying to focus on testing of patients that are symptomatic. If you're asymptomatic and you want to get tested, you have to go to your primary care doctor and to get an order to be tested. So if you're asymptomatic and you're sharing and you're in a family with others, with someone who is, as long as you're all willing to share the 14-day quarantine, there really isn't a point to getting the additional family members tested, because the protocol remains the same as long as you're asymptomatic. And that's, you stay home, you stay quarantined for 14 days. And then after the 14 days, as long as you've been symptom-free for at least the last 3 days of that, you can return to general population. So being tested would only confirm how many of us in the house actually got it, but it will not change the ultimate outcome unless you become symptomatic. So hopefully that helps, Eugene. I hope I clarified that. And I got another question. Sometimes when I breathe or eat, my heart aches as well as my lungs. Is this considered a sign of a PE or just normal signs and symptoms of shortness of breath? Sounds more like signs and symptoms of shortness of breath. When you get a PE, it's consistent. It's not, it does not give relief. So you won't suddenly feel shortness of breath and chest tightness or back or chest pain, and then it suddenly relieve and goes away. It's numbing, it's consistent, and then it gets worse and progressive and progressive. So if you're having those symptoms, definitely see your doctor just to get checked out, get a chest x-ray, make sure that maybe, I don't know if you have any history of asthma or any other respiratory allergic issues, but it definitely wouldn't be a PE. A PE would be consistent and progressive. Okay, great question. And okay, it looks like Eugene answered your question. And Maureen says, sorry, can't hear you. Can you guys hear me? Oh, better now. Okay, she can hear me. All right, it looks like that's the end of the questions. I don't see any other new questions. Thank you all for joining us today in our webinar. We really appreciate it. We are going to have a clinical webinar tomorrow given by Maureen Daly. She's our clinical nurse educator. So please look for an email for that. And I'm sure it'll be something exciting. I believe it's going to be on educating CNAs in the clinical practice in the skilled nursing facility. So look for that. That's a great presentation you can give to your staff, your CNA staff as well. So let's see, I want to make sure I didn't miss anything else. Awesome. And thank you guys all, the ones who said thank you. I really appreciate all of you, Michelle, Angela, Gabriella. I really appreciate each and every one of you, and all the other people from the other states that are listening in. Don't forget, if you have any questions, please text me, and I'll make sure that we can respond back and resolve any questions you may have. Also, if you're not working with us and you'd like our support, we'll still reach out and support you. Just reach out. You can call our corporate office, or you can text my cell phone directly. Both are easy ways to get in contact with us, and we can be helpful. Thank you all so much. And we actually completed within an hour. That's awesome. Everyone have a great afternoon and evening, depending on what time zone you're in. We really appreciate you guys coming, and have a great afternoon and evening. Take care.